transformations that you have designed, developed, and implemented, it is understood that you have made the transformation from a kind of reactive treatment or reactive healthcare towards the proactive healthcare, right? So, would you like to talk something about your organization first, about active wellness, and this transformation from reactive to proactiveness? So, would you like to share this? Shall we begin with this part?
Thank you. Active Wellness is an organization that is
Come closer.
Active Wellness is an organization that is made and promoted by a set of clinicians both within North America as well as India, and a team of technical experts which span India, Taiwan, and North America. The genesis of getting into transformation of health started from looking at what are the problems being faced in the current healthcare delivery. The current healthcare delivery is reactive in nature and only focuses on delivering treatment for sick events, meaning thereby the hospital systems as they exist today only manage an event, and this event management is what we call as reactive healthcare. Though we have created number of centers of excellence in managing sick events, we have not been able to stem the tide of having patients who are flowing into the healthcare system. It is this throughput that we wanted to solve for, and we have developed, and what we talk about is proactive pre-acute care. That is, how do we manage a population which is not yet gone sick and prevent and reduce the incidence of hospitalization and burden of disease.
Great. We have Mr. Tushar Rai here. He is senior consultant at National E-Governance Division. Probably he would like to intervene in this discussion.
Right, sir. So I think that's a very nice and a great innovative step towards a proactive treatment. Can you please outline, the current challenges? Like if I go to a doctor in a physical clinic, I have to stand in queues and, I have to tell my disease and perhaps there'd be some diagnosis and I'll be getting some medicines. So how exactly, what are the challenges in the current system and what are the solutions that your system would be providing me as a patient?
And that's a great question. So the current healthcare system is disconnected, siloed, and is not able to have a complete health system. It is transactional in nature. You have an event, you go to a hospital, you are treated and you are sent back home. There is no system which looks at you as a whole individual. So it is in active wellness, we have tried to address the generic pain points that are being met by not only the patients but also by the physicians who are treating patients. So the general pain points that the solution addresses is accessibility, anywhere, anytime, having a continuity of care record that can be available globally wherever a patient is going. How do we complete our healthcare transactions, have access to a healthcare marketplace? Can I connect with other people who have a similar problem to learn, share, and understand what works for them and that may work for me also? So the integrated, focused social network is a comprehensive part of the solution. Other than this, the pain points that are normally being faced by patients is, how do I get my orders serviced? That is, I have to go to a pharmacy to go and collect my medicines. I have to stand in a queue to get a test done. I am not told what are my screenings that need to be done. I am not aware when do I need to go in to see a doctor, and can I manage it on my own? So the application has an inbuilt intelligence which, based upon the responses being put in, generates a risk score, and your risk score in turn defines what are the next steps that you need to do, whether it is a consultation with a psychologist or consultation with a clinician, and what are the preventive screening and tests that you need to do which are mandatory from your age, gender point of view. So it is actually a whole of life system which a person can enter at any point in life, of his life, and have himself managed.
That's really nice, which means that even if you're not sick, you can just enroll to this program and you can get yourself screened and have your risk assessment done, and then perhaps I'll have more solutions. What steps do I need to take forward to sort of prevent for any future diseases, right, sir?
Absolutely. So the problem that we face is 5% of the population is consuming 65% of the healthcare spend. That is the immediate opportunity for cutting down on costs and preventing hospitalizations. There are a set of population who are at risk and they are not aware of their risks. And if those risks can be identified 3 to 4 years before the disease onsets, so a person can actually prevent the onset of disease. And for a healthy person, he may be healthy now, but he may not be at the best of his health. The system helps him define what is the right inputs that he needs to add now to keep healthy and remain disease free. So it is a whole of life system which stretches from pre-birth to end of life and has a great focus on ensuring compliance and ensuring that the pain of transactions within the healthcare system are removed through an anywhere, anytime, 24/7 access to healthcare.
Sir, if we think from the stakeholder perspective, we have various stakeholders. They have their varying requirement, they have varying needs, and they have varying challenges also. For example, people living in urban, their life is quite fast. They have lack of time. Okay. From a student perspective, they are not really caring about that one at that point of time. From the farmers and the people who live in the urban areas, they have their own challenges. I mean, lack of information, lack of communication. So if we target these audiences, could you please elaborate how these stakeholders could leverage best the application which you have?
A great question there. So the system is a cloud-based solution which can be extended across geographical locations. All that is needed is an access to a net, either on the mobile or on a PC. All a person has to do is either himself or through his attendant answer the set of questions. It generates a risk profile and defines what are the next steps he needs to do. From a government perspective, if I have a population of 100,000 people, and if I can identify the health state of my people, I can plan proactive interventions for different sets of people. These interventions are not one size fits all that you see in healthcare today. These are personalized interventions that are built on the basis of the artificial intelligence built into the system and allows a person to get personalized, anywhere, anytime, access to health. And also the system has built-in mechanisms to ensure that there are no adverse events that happen because of medications being taken by him. The system has a robust medication management function. You will all be aware that 13% of all the healthcare costs are actually going into managing the adverse events which happen out of drug therapy. The system has a built-in intelligence that actually prevents a provider from prescribing a drug if the person is allergic to it or he has interactions with his ongoing drugs. So the built-in intelligence actually helps to shave off the adverse events that happen because of multiple, duplicate, and adversarial combinations of drugs. Other than this, this system has built-in capabilities of actually identifying who are compliant, who are not complying. The person who is not compliant actually now the next question would be that how does a person know that I need to do an activity? The process flow has built-in alerts that are personalized and generated depending upon the health profile of a person. So the alerts may be around medications, consultations, drugs, tests, or assessments. Even if he reads an alert, the alert, if not acted upon, generates and gets escalated to a concept which we have built in is a personal care team. So the care team gets a real-time alert that Mr. X, who is on an antihypertensive drug, has missed taking his drug and actually identifies for a real-time intervention by a care team to prevent an adverse event. So we believe that by this method, the
Sir,
adversity reduces.
Yeah, that is wonderful, sir. One thing, many of our viewers available on social media would be interested to know. Let's say if a person has no idea about your product, no idea about the application, what does the person really needs to know? I mean, the name of the application or the URL or the mobile app, any registration process, so they would really understand what, if they have no idea, what do they really need to do to leverage your application?
That's a great question. So while we were designing this application, though it has a massive complexity at the back end, we've made it very simple, easy to use from a perspective of an end consumer. All he needs to know is to understand English language, and thereafter he is given a set of questions which are simple English language questions which have choices that he needs to fill in.
Any URL or website for this one, a mobile app?
Yeah, this
would like to share.
The mobile version is getting launched in the next 35 days, and I will.
Name of that? Okay, it has not been launched yet.
So the application can be accessed from both a mobile and a PC, and this application will allow people who have the basic understanding of English to manage their health. The aim is not to push everyone into a high cost, high spend environment. The application analyzes the health needs of a person and may actually reject a person signing up for a high paid package by telling him you are not needing this. All you need to do is just sign up for the free services, and that is all at this point of time. So the application is wanting to become the trust partner in health for the population. So the application actually wants to achieve the 3 E's. The 3 E's are: how do I engage, how do I enable, and how do I empower my patient population so that they can manage their health and actually ward off the catastrophic illnesses that are hitting the population today in the area of chronic disease segment.
Excellent, sir. So just coming back to the the artificial intelligence, which is basically built inside the system. Let's say I believe, let's say a 30-year young man comes to your clinic, or perhaps in other case a pregnant woman needs some health care, or a 60-year-old woman needs some has some disease issues, etc. So how exactly the system decides what is the best package which needs to be given to these various stakeholders or the patients depending on their profile? Can you just give an...
So our focus has been, a large amount of our focus is on 2 areas. Number 1 is on the mother and child. The mother and child form 40% of our population and are a neglected lot. So the system actually has built-in questionnaires, built-in methodologies by which a person just needs to answer a few questions and the system will automatically generate a risk score. The risk score is based upon the statistical evidences that exist as to how she needs to manage her health. The application starts from the stage of preconception. A couple can actually find out that are we ready to start a family? And in case a couple is not medically ready to start a family, it suggests what interventions that they need to do today to ensure that they have a healthy pregnancy, a healthy baby born at the end of pregnancy. The application manages the pregnancy of a woman throughout the pregnancy cycle and the child is thereafter managed through the monitoring of the developmental milestones and the immunization needs. So it's a complete ecosystem which takes care of the mother and child right from preconception to the child becomes an adolescent and adult.
Sir, one thing that generally people have kind of a stigma that they have some family doctor or family consultant, right? So if I have any problem, I always go to my family consultant or family doctor. Once we shift to this application, right? So the virtual consultant which you have mentioned in your text, is this something that the application decide, or it always allow me to go to only one doctor? Because sometimes it always a sense of satisfaction also, because I always go to you and I get a lot of satisfaction when I sit with you and you gave me a word of wisdom. But how does it really map the physicians or the consultant?
Absolutely. So the application does not limit that the care team has to be the one decided by us. A patient can actually send a joining request from within the application to his family care physician that please join this application, and the physician on joining can have access to the patient's record. So we are not disrupting his current healthcare practices. All we are saying is that we are digitally enabling, creating a marketplace where a patient has the ability to access the care needs through a set of providers. So the providers can be the set of providers whom he chooses, or the system can also give him a recommendation at who is the right person for you for the conditions that you have. So the paradigm difference that we have here is that the care team is not just a set of a physician alone. It consists of physicians, nutritionists, pharmacologists, care coordinators, and also we believe that the best compliance can happen if someone from within the patient's family is a part of the care team. We call it kin care. So whenever a person is defaulting on any compliant issue, an alert goes to the kin. So the best people who are interested in a person's health are the kin of the patient, and their interventions will help push up compliance and thereby warding off unnecessary hospitalizations.
Right, sir. So I believe, our friends from social media would also be interested in, to know whether you are using any social network communities on your portal, how they can get involved and how a community can be built around this application.
Great, that's a great question. So we realize that social media today is a medium that needs to be leveraged and which everyone wants to leverage. We have built an integrated social network which is focused on healthcare needs. So you have focused communities and forums which allow you to join, share, engage, learn, and connect with other people having similar problems. The difference between public and the closed communities that we have is that the records of an individual here are kept de-identified, and he can maintain his anonymity, which is difficult to be maintained on the current social media platform. So we believed that we need to have a focused community where people can join disease groups or treatment groups, learn, share, and understand from each other, and thereby improve their engagement and their willingness to comply with the medical needs. Over and above this, we have created a closed community for providers. In this community, providers can not only share, learn, but also engage with their colleagues, share clinical cases, learn CMEs, have access to evidence-based practice and clinical workflows, which will allow them to deliver evidence-based medicine and reduce the clinical variation that we are seeing in the way they practice. So the social networks are an integrated part of the complete active wellness ecosystem that we have put into place.
Right, sir. That's excellent, because that's why they say that sometimes, the old patient is better than a new doctor. What has been the feedback, that you would have been getting from the users? How positive, and would you like to quote any example, any user getting benefited?
Absolutely. So The problems that this solves is that it allows you to actually fix an appointment. You can do an e-consult. An e-consult can be or a clinic visit, so it does not hamper you. In clinical practice, after you've done a clinic visit, the subsequent visits can, which are to show reports or to see the progress, can be done through an e-visit, which can be either through a video consult or by an audio consult. So the system allows you to fix appointments at the time and place of your convenience and that of the provider, and actually disengages or disintermediates the healthcare system from the provider-patient interaction. And the response which we are getting from the providers is that this is a great medium for us to maintain our privacy and also still service our patients.
Sir, we would like to know the impact of this one. I mean, how the physicians or consultant or doctors are getting integrated to this application, because when you talk about the virtual consultancy, it means the doctor should be available on this portal, right? And then how was the response from citizens? So how is the journey so far? What are the major little success stories or the challenges would you like to share with our viewers?
So we found that people who are suffering from chronic disorders, and the chronic disorders are the non-communicable diseases that are becoming the problem of not only India but also the problem across the world. The current approach of the patients was that if I ever want to get a healthcare intervention, I have to go to a clinic or I have to wait in a long queue. They believe that with the alerts and the response systems that are built in, their compliance with medication has improved from 60% to 90%. The number of reactive visits that they were doing to the emergency rooms or going to a clinician have reduced.
Any specific area of the any specific locations of India, cities?
Currently, this is being launched, has been launched in the Tri-City of Chandigarh, Panchkula and Mohali. The ecosystem has physicians who are being onboarded. The physicians have a larger input into their practice. It creates a win-win situation because a physician can now manage his practice and can keep his patients in the cloud, access the medical records on a fly, and he can move from just giving a treatment plan to a holistic care plan. So the other element that I wanted to highlight is that this application is not treatment based. This application is a care plan based. The care plan covers all facets of health, starting from wellness, prevention, risk identification and reversal, early disease detection, and effective chronic disease management, so that your morbidity gets low, your life expectancy improves, and you can lead a normal life without having an adverse event that may come your way because of not being managed in an appropriate manner.
Right, sir. So I think that covers a lot of, the initiatives or the aims that the government also is having regarding in line with the Digital India theme, right? So how you propose that, the government can also leverage such initiatives?
So what we have done is that besides the transactions that are being recorded by a patient in his own personal health record, the transactions are being stored in a data warehouse. So what we have created is that we are creating a master data warehouse in which the transactions of all patients are getting recorded. And now, whenever a government wants to undertake a surveillance program and respond to emergencies or identify hotspots, the government actually has a system which gives it near real-time intelligence as to what is not working well in an area and where do they need to move in a more active. To give it in the form of an example, I may find that people in a particular city are overweight. They tend to be having a higher number of diabetics in that area. So we know that there is a demographic element that is pertaining in an area. So the platform actually allows government to target these populations through education and literacy drives, which can be both through a e-medium and also by way of interventions or clinics where these patients are actually asked to come in and they are incentivized to come and manage their health, leading to reduction of the elements of cost which happen out of a hospitalization. We believe, and that is a study which has triggered the movement towards population health as a need of the hour, because proactive prevention actually cuts down on healthcare costs by 20%. And the advantage that we get out of reduction in healthcare costs is not only the direct costs, but also the indirect cost of lower productivity gets addressed. So it is a calculated fact that 1% reduction in cost acts as a 4x economic multiplier, and it actually goes forward to boost the economic growth of the country by increasing the productivity, decreasing the morbidity and mortality, and giving an added flip to the economic growth of the country.
Sir, thank you very much. And probably in the last, we would like to say a few words about, for our viewers on social media. Many students are there, many professionals are there. Generally, we do not get time. I mean, we are not that much kind of health sensitive. So, would you like to say a few words for those people, I mean, message that how, I mean, about the sensitivity of health, and any message to their students and professionals who really sometimes forget to care about their health?
That is great, and I would only request that we have 24 hours a day. We must take time out for ourselves and our body. A healthy mind can only be in a healthy body. And for that, active wellness actually encourages you to join up for free and have access to the knowledge content and the social networks, which will help you understand what are your health needs that you need addressed, and will actually promote or engage you into becoming more aware of your health needs. And once you are aware, I think so 90% of the battle is won. And I guess it is not only you and your awareness that is important, but also your awareness will help you meet the health needs of your near and dear ones.
Thank you so much, sir. It was great and wonderful to have you here. And you came all the way from Chandigarh to attend this program. We are really thankful, and it was just great to have you here. We have Mr. Neeraj Agarwal, Director, National E-Governance Division. We would like you, sir, to please come on the stage and give a token of appreciation to Dr. Agarwal.
Thank you, sir. Thank you very much.
Thank you so much. Hello. Yes.
Hello. Yeah. My question to you is how the government infrastructure, the primary health centers and government hospitals can use this infrastructure which you are building, or is there any connect, or can we leverage this technology in our health hospitals?
Absolutely. So all that is needed is that the government has a large infrastructure and a network of bandwidth across a large number of primary care centers. Just the presence of a PC or a multi-purpose health worker in any location provides direct access to the system on an anywhere, anytime, in any location. The only requirement is that of connectivity. So this is an ideal platform to take care of our emerging needs of managing and controlling and monitoring our preventive strategies, which are currently being managed only by way of a physical visit, having a way by which we can not only see that who is doing what in which location, but also seeing the outcomes and seeing the prevalence of different parameters will help the government not only intervene, but also define and transmit additional interventions by way of prevention into these areas. The system will also allow the government to monitor and weed out leakage from the system, because anyone who's taking a drug or who's doing a procedure gets recorded in the system. That same procedure cannot get repeated in another location. It will prevent multiplicity of tests, because a test done a week before does not require to be repeated again. So we are saving on costs in terms of tests. It also helps identify drug interactions, which are one of the major causes, and weeds out the ability or the need of superfluous medicine. The system actually promotes the use of generic drugs, which is the Government of India policy directive. So this program actually, with the complete data warehouse facilities, helps the government to know where the interventions are working. If some interventions are not working, what is the modification that we need to do to make sure that they work? So it actually is an interactive way by which all of us can access the outcomes of the healthcare interventions that we are planning for the population as a whole. And it is ideally situated for the rural areas, where a multipurpose health worker, all he has to do is just put in the questions, by answers to the questions which are generated by the system, and the system will automatically generate a recommendation and a risk score. It will also go forward and recommend that this patient needs to actually see a physician. And if he does not need to see a physician, it will actually recommend what are the next steps that need to be done. So it thereby pushes the skill set to a leftward curve. So what is being done by a physician can now be done by a lower skilled worker and reduce the load on the physician, and the physician can now actually go in and provide interventions for the targeted population that has been identified by these workers, and his time is more productive and into the delivery of care. Thank you, sir. Thank you so much. And thank you everyone for having me here, and I look forward to similar interactions in the future.
Thank you, friends, for joining us. Thank you much.